Hi, this is Dr. Sachin Patel. Thanks for joining me on this short video. Today we're going to be discussing a very important topic that's often overlooked and doesn't get the attention that it deserves. We're going to be discussing how hypothyroidism affects digestive function. Your digestive system is one of the most important systems in your body, and it's where all disease starts and ends. In fact, most thyroid disease actually starts in the digestive system. Very hard for people to understand this, but your digestive system sets the ceiling for your health. If I want to build a new you, if I want to improve your health and optimize your physiology, it always starts with digestion. This is why diet can have such a profound impact when it comes to your health, and especially your thyroid health. Your digestive system is the system that delivers the nutrients that your thyroid needs to function properly. It's also important because it's what houses your gut microbiome, which science is showing us more and more every day the significance of our gut microbiome. So this short video will discuss how hypothyroidism affects digestive function, and it'll give you a few strategies on things that you can do, but I hope that this whole series of videos gives you complementary strategies that you can implement to improve your overall health. So let's get started. Hypothyroidism has a significant impact on digestive function and is often overlooked. Unfortunately, many people don't get the help they're looking for. Most hypothyroidism occurs secondarily to an autoimmune disease known as Hashimoto's thyroiditis, which we've discussed in other videos. So it's important to note that when you have one autoimmune disease, you may have another. So you may have a separate and distinct digestive issue going on separate from your thyroid condition. The severity of your symptoms can vary based on the severity of the disease process, as well as your diet, your gut health, your levels of exercise, and how well your condition is being managed. Let's talk about the stomach and esophagus. Of course, there's many organs that are associated with the digestive system, and we'll get into a few of them. Poor thyroid function can lead to difficulty in swallowing due to disruption of what's called esophageal peristalsis. So this is the actual rhythmic contraction of the muscles in the esophagus. It can also make it difficult for you to swallow your food because of enlargement of the thyroid itself. People who have low thyroid function may also experience delayed gastric emptying, which means food can sit longer in your stomach than it should, resulting in bloating in the upper digestive tract, heartburn, dyspepsia, and other upper GI symptoms. Decreased stomach acid, known as hypochlorhydria, is often associated with hypothyroidism, and this is due to decreased function of the cells that produce stomach acid in your stomach. This leads to decreased protein digestion, which can lead to water retention, joint aches and pains, and also keep in mind that protein is what carries your thyroid hormone throughout the body. Protein is also very satiating and important for muscle building and also building the three-dimensional structures in your body. It also leads to decreased duodenal rhythm. Now let's look at the intestine and colon and how it's impacted by hypothyroidism. Typically, calorie extraction from food is higher due to delayed transit time. Many patients will report bloating and discomfort, and this can be caused by gas that's produced by specific types of bacteria in the gut. Patients might also experience changes in the gut microbiome due to delayed transit time, but also altered by the types of foods that you're eating. Gas and bloating are common symptoms. Now let's take a look at how hypothyroidism affects the liver. The liver is one of the most affected organs by hypothyroidism. It causes decreased oxygenation of the liver, decreased gluconeogenesis, which is the production of glucose from stored glycogen. This can result in constant carbohydrate cravings. There is increased cholesterol production to counter the permeability of the vascular endothelium and low bile output. So our body will make more cholesterol. This is why it's common for patients with low thyroid function to have elevated levels of cholesterol. This is not pathological. This is a sign of adaptation. There is usually increased incidence of gallstones and gallbladder issues in thyroid patients. There's decreased bile flow and increased stagnation. Bile is not only important for motility, but it's also important in emulsifying fats and digesting our fats. This can also lead to compromised liver detoxification. So patients with low thyroid function can experience a lot of symptoms associated with poor liver function. The liver is crucial in one's overall health and wellness. Other GI issues that can result is that there's typically a 5 times increase in the development of celiac disease. Pernicious and iron deficient anemia are actually quite common because of low stomach acid production. And also pernicious anemia is caused by an autoimmune condition. And therefore, since most thyroid cases are caused by Hashimoto's, which is an autoimmune condition, it's not uncommon to see pernicious anemia as part of that matrix. Oral bacterial overgrowth can also lead to thyroid and other health issues. So it's important to take good care of your oral health, not only from a standpoint of brushing your teeth, but managing the microbiome in your oral cavity. We usually recommend getting this tested to many of our patients and find that many patients have oral bacterial overgrowth or dysbiosis. This is bacterial overgrowth that occurs under and in between the teeth, and it's difficult to brush away. Constipation can lead to changes in systemic bacteria and cause overgrowth. This can lead to a lot of issues down the road. There's also increased risk of colon and GI cancers due to poor motility. And the way I position this with my patients is that imagine not flushing your toilet for 2 or 3 days at a time. This could be a very, very toxic environment. And our bowel is not meant to be a storage center. It's meant to be a temporary storage site. We should be eliminating 1 to 3 times a day. And unfortunately, many GI issues are overlooked or just simply dismissed. So it's very important that you pay very close attention to your digestive health when it comes to managing your thyroid. According to Hippocrates, all disease starts and ends in the gut. And we believe this to be true as functional medicine practitioners and play a huge emphasis and role in identifying the underlying mechanisms of your thyroid issues as well as your gastrointestinal issues. In closing, I'd like to thank you for joining me on this short video. I hope you found this information to be helpful, and I hope that you can apply what you learned today in your day-to-day routine. Digestion is so critical to your overall health, and unfortunately, it's overlooked or downplayed when it comes to your health and wellness. So please take some extra steps to optimize your digestive function. Use these videos as a resource to help you move your health in the right direction, and we hope to see you on the next video. In the meantime, I hope you have an amazing day. Thank you.